looking for answers. And a lot from morning, persons have been saying, can you call Dale to try to explain to us here in Dominica what may have happened? Dr. Dale, good afternoon to you.
Hey, good afternoon, Matt. I want to start really by extending, my deepest condolences to her family. Obviously, I knew Ferdina. I was on a show in 2015. We grew up in Point Michel together. I really want to extend my deepest condolences, especially to Joan Frampton and the rest of the family and her brother, obviously. But where do we begin? And I'm just obviously when you get that call, I was not aware that she was hospitalized for that period of time. So throughout the last 24 hours, I had time to sit and really process all the information I was getting, and then I heard the voice note, and then I sort of said, what could have happened? And I think it's important to note certain things, and I want people to really pay attention to the things I'm about to say. I know this morning, you mentioned maybe clot, because a lot of information I get out of Dominica throughout the years is, well, it could be a clot. But remember, that is just speculative. You have no diagnostic evidence of that. And I know right before you brought me on, you said that, you're looking for medical answers. You cannot have medical answers without an autopsy in this case. So that is very, very important. If they don't have an autopsy, it will all be speculative, right? You could say that she had a clot that went to her lungs, but that's speculative. Unless you can get an autopsy that shows the clot in the vessels of the lungs, then like I said, it's only speculation. Could she have had a heart attack? Yes, that's also. But let's go back to the clinical scenario. Okay? She goes into the hospital with dengue. Let's say, how was that diagnosed? Do we have the lab test in Dominica to diagnose dengue? Dengue, to be hospitalized, is really severe dengue. Mild dengue can be treated at home. It's supportive care anyway, right? Let's minus the fact that now it's been said that she was diabetic. Okay, she had an abscess. If she had an abscess that was so bad and she came into the hospital, why did it take almost 2 weeks to take her to the operating room? Because she went last Thursday for the drainage of the abscess, right? What was that delay in draining an abscess? If I come to the hospital with an abscess that is that bad, that's an immediate, within 24 hours, you're in the operating room, I'm draining your abscess, right? That's one issue. The other issue is this. Ferdinand was a heavy set woman, right? She's in the hospital for 3 weeks. The fundamental question that I have, was she on prophylactic, anticoagulation? And what does that mean? Was she on sub-Q heparin? Was she on Lovenox? Was she on any of these medications that would decrease blood clots in the leg? Because when you're in the hospital that long and you're on bed rest or people are not getting you up and moving, you're set up to have these so-called clots, right? So she was a setup to develop clots in her leg, and thus the pulmonary embolism, which is the clot going to the lungs. So that's another scenario, right? All our trauma patients up here, for example, when they come in, they're on what we call DVT, deep vein thrombosis prophylaxis, to prevent clots in the leg. If she's going to go to surgery, she still needs that prophylaxis, right? So did she have that? If she didn't have that, she's a setup for pulmonary embolism, which is a clot to the lung, right? Did she have an EKG, right? We're now hearing that she had, certain medical comorbidities. Did she have an EKG that showed any change, right? Did she have what's called a troponin, which is a myocardial infarction marker when you're having a heart attack? Did they draw any labs in that regard? At least to get a baseline, because again, you have a patient with dengue, an abscess, coming into the hospital, right? You want to have a baseline in terms of a medical information, right? So these are the basic things that you have to ask. Now let's get back to the scenario that I'm hearing about her coming into the last 24 hours. She was complaining of shortness of breath and chest pain. These are cardinal signs of something's not right. Something's not right, right? One, what did you do about the chest pain at that time? If you did not have an EKG when she came into the hospital, did you do it right there and then? It takes less than a minute to get an EKG, or at least some sort of cardiac rhythm strip to see where you are, right? What else was done in that immediate period of time? Was she intubated? Did she get to the point where she needed to be on a ventilator to at least support her? Even if you have a clot go through your lungs or you're having a heart attack, you got to protect the airway and get the patient through this, right? We talk about what's called MONA for chest pain, right? The morphine, the oxygen, the nitro, etc., the aspirin. You stabilize the patient. What was done? So without all that information, we really cannot come to any conclusion. And at this is now a mortality that needs to be reviewed not just from the clinical staff, but also from the coroner standpoint in terms of an autopsy. If you don't have an autopsy, we will never get the answer of why she passed. So these are the medical things, right? So the pulmonary embolism, which is the clot to the lungs, or a massive heart attack, are the two working diagnoses at this point. But again, I will say this, and I've said this all along. What is in place? We don't know what's in place. Did she get morphine? Did she get nitro? Did she get put on a breathing machine? What was done in that period of time to try to save her life? Remember, airway, right? ABC. Airway, breathing, circulation. But you have to maintain the airway. And once you lose the airway, you lose the patient.
But Dr. Dale Dangleben, of course, I know she's now at the funeral home. Do you think an autopsy should be done at this time, or she should have been left in the hospital so the autopsy could have been done?
Well, again, the process issue, with the fact that she's in the funeral home, what does that mean? This is what we up here we call this a coroner's case. This the pathologist has to do an autopsy and look at any evidence in the legs. Were there clots? One, are there clots in the lungs, right? Or take a look at the heart. Was there a myocardial infraction? How was the coronary vessels, the blood vessels to the heart? Did she have plaques in the heart? All these things are part of the process in coming to that conclusion. So the fact that her body is sitting at the funeral home already, I think we've sort of, where are we going with that? And that's what bothers me tremendously, Matt, is that we don't have the usual process that has been established in medicine, and that I don't see coming out of Dominica that we used to have. Why aren't people advocating for the population when it comes to proper health care? Even in death, you cannot get the right things done. She needs an autopsy. She needs an autopsy to show whether or not she had a pulmonary embolism. And I will say this. If she had a pulmonary embolism, which is a clot to the lungs, I would like to know for the 3 weeks that she was at the hospital, or the 2 weeks, did she have any DVT prophylaxis, right? Deep vein thrombosis prophylaxis, which is a daily injection that you get to decrease the chances of that happening. If she had a myocardial infarction, which is a heart attack, did she have an EKG? Did she have the troponin, right? Did she have the appropriate things done when she was decompensated? Was oxygen placed? Was she intubated? All these things. Was anesthesia involved? There is so much lacking in terms of information that we can only speculate. And as a medical expert, I can tell you it's all speculative. In trauma up here, the coroner comes in. The coroner will say, this is not a coroner's case, but I could tell you most of the trauma patients, the gunshots, the this, the that, they go through an autopsy. And I can tell you, we get a report back, a very detailed report that, tells us why the patient, passed. So, unfortunately, this is...
But I'm being told by some family members at this time, Dr. Dangleben, that she has been sent for and she is now doing the autopsy.
Okay. So that will give us all the information that we need in terms of where, because everyone is saying clot. The autopsy will give us some information, right? And an autopsy is a well-done autopsy is very detailed. It will tell you the condition of all the organs and what pathology is found in these organs that would most likely contribute to her demise. And again, it's really heartbreaking because, again, this is somebody we know. She's, Ferdina is younger than us. And this is somebody we know. This is a very productive member another very productive member of our society who has passed on. And you have to ask yourself, is this is her demise? Is this a result of the lack of healthcare in Dominica? And I can tell you at this point, based on what I'm hearing, I would say absolutely yes. And again, I know we're not there to talk about this, but if you go into the hospital for the drainage of an abscess, and you pass from that 5-6 days later, then you have to do a full analysis in the system. What we do is called M&M conference. It's called Morbidity and Mortality Conference. I review every death in our hospital, right? I mean, in terms of the surgical department, and I have what's called secondary and tertiary, and we decide, we have discussions. What could be done differently that when the next patient comes in with a similar finding, that this does not happen? Is that process taking place as we speak? Are they looking at a root cause analysis right now to say, hey, this is where we went wrong, this is what we should have done differently, and what do we do next time when we have a patient with that similar situation? How many ventilators are on island, Matt? Do you know?
No idea. No. But I'm hearing too from a very reliable source that the reason why Ferdina is at the funeral home or was at the funeral home is that the chiller at the hospital may not be working. It has been, not working for a while, and that is why there are no coroner cases at this time.
Right. So you see, and again, that this compounds the whole situation that we've talked about, the failed healthcare system. And I got reliable information that the reason why they were using Demerol is because they've not had morphine for 6 months. Right? That's another thing that the public should have been notified about. 6 months without morphine, so they had to substitute with Demerol, and then they ran out of Demerol. So the question I have is, was there a delay in diagnosis with Ferdina in terms of the timing to take her to the surgery for the draining of an abscess? If you're in the hospital for an abscess, that needs to be drained immediately and taken back maybe the next day, right? Because again, I'm hearing a voice post-operative. It sounded like she was okay. What else was missed in her care?
Another family member is now reporting to me that she had a fever for some time. See?
Well, yes. I mean, with a fever, I mean, with the abscess, that's expected. And you drain the abscess, you pack the abscess, you keep the patient on, wash you on the appropriate antibiotics. Did we send, was the wound cultured? Did we grow the bacteria that was in there to really to be very specific with the antibiotics that she needed to be treated with? These are all so many questions that we can ask. And again, it's in retrospect, but again, without the healthcare providers talking, without the Ministry of Health talking, how do we find out? I've always said for the last 10 years that we practice in medicine in Dominica in the dark. There is no data, right? There is no process in terms of resolution.
And again, somebody's requesting or suggesting that maybe an independent pathologist should be requested by the family, in his opinion, an independent pathologist.
Well, I don't know how the process works in Dominica, and again, there might be costs and things like that, and how many of them are available in Dominica. These are the things that, again, as the population, we have to be worried about, because I could tell you, I read Ferdina's brother note, and it really just, tore me apart because, like he said, and this is what I've been talking about. What happens when it visits your doorstep? When it's your family? You know what I mean? And again, this is very, very heartbreaking that this is what has happened, and we as a people, we have to start speaking about these things. I've been screaming from the mountaintop, and people try to vilify, not realizing that I have insurance, and Scarrett said he can fly out and all these things, but you were there, and you're suffering, and you're dying, and your loved ones are dying, and nothing is changing. There is no morphine, there is no Demerol, surgery is being suspended. What are you doing? What are we doing as a people Dominica is a failed state in every aspect, every sector. Dominica has failed, right? Even the animals don't have feed right now, as I'm hearing. What are we gonna do? What are we gonna do? We lost Ferdina, and we have to ask ourselves, is this a preventable death? And I know I've spoken to about this on your show several times. This idea of preventable death, and people have challenged me on, well, there is no such thing as a preventable death because it's in God's hands. But I think that's the problem. That's where things lay. We have to be more open and honest with ourselves when we look at these things. There are preventable deaths if we have better healthcare in Dominica, and not just better healthcare, but again, the staffing is part of the healthcare.
I just said that there, Dr. Dale. It just brings something to my mind, brought something to my mind. And I'm sure you, like everybody else, or many people, have heard a voice note circulating from the very ward where this patient was, talking about Ferdina Frampton, and some assistant, some nurse or somebody is spreading some false information about what was going on there. And that's so unprofessional.
So, and I have spoken about this too, and that's something this nurse should be fired immediately on the spot. No process. No idea of asking her what happened. Just based on her putting out that voice note, she should be fired immediately, right? And that's another thing in Dominica, right? Patient health information, PHI, is is not protected. People come on media, they talk about other people's things. You cannot do that. That's a violation of here. You will get fired for this. You will be escorted out by security. We need, well, again, this shows, I listened to the voice note and it almost made me cry because, it's gossip. It's garbage, right? Somebody is in your care. Your job is to make sure that this patient does well, not go out there and talk about these things. I mean, this is disparaging. This is horrible. This person should be identified and should be fired on the spot. No going to HR and having discussion. Dominica, we need change. We need process. And again, this has really hit home. And again, we need to talk about it all. Not just the system, but our individual care also. And I wanna take the opportunity to say that because I know folks are listening. We have to take our health into our own hands also. I'm hearing, she's diabetic. She was this, she was that. And again, I don't know Ferdina's medical history, but we also have to do better so we don't go to this. And another thing, Matt, is we joke about this. We call it the hospital, the gentle rest. We make jokes about these things, and it's no joking matter. It's not joking matter. This is not a joke. People are going in there for basic procedures and dying. I'm reading stuff on Facebook. People are talking about their family members going in for one thing and ended up on dialysis. And we have to pay attention to these things. I'm pleading with the Dominican public that this has come. The chickens have come home to roost, and we have to do better. And the way to do better is what our people like me and you and so many other people have been screaming from the mountaintop is, yes, we need to revamp the system and we need a change of government. This government is stale. They failed the people. They bankrupt the country. And we cannot even afford medication for the hospital. We can't afford spinal needle. And look at what happened. This couple of days ago, we were talking about Demerol. And now we're talking about, burying Ferdina. I mean, oh my goodness, man, this is heartbreaking.
Dr. Dale Dangleben, as usual, thank you. Of course, trying to get some answers to the many questions we've been asking for the past few hours there. Very telling there. Health system, very telling. Thank you again, Dr. Dale. Thank you. Bye-bye.